Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh, and a very good morning. Thank you to Chairperson Professor Dr. Shatria, and also she is my beloved supervisor, my main supervisor, beside with other co-supervisors. So today I will share my research about development, validation, and application of quality of life questionnaire in children with infantile esotropia and their proxy parents. Okay, a little bit of background. What is infantile esotropia? It is actually an inward deviation of the eye, a strabismus onset before 6 months. And also it is the most recognized type of strabismus, constant and large angle at distance and near, with low to moderate refractive error, ocular motility disorders, cross-fixation, and can be managed either with non-surgical, surgical, or combination management. Okay, now we want to understand what is the psychological and functional impact of this condition. Functionally, children with infantile esotropia, they will suffer from lazy eyes, depth perception, and also eye movement. What about psychological problems? These children usually they have poor self-image, depression, and these can lead into higher risk of psychiatric disorders. And other than that, parents, especially mothers, are more distressed, dissatisfaction, and have poorer family relationship. So we are thinking about to develop a tool, a scale, a measure to measure this quality of life of the children and also their parents. So when we do the literature review, what we have nowadays, we have generic questionnaires, which are the SF36, EQ5D, and PITS-QL. And the vision specific, that is NEIFQ and also IVI. About the strabismus specific or the squint specific questionnaire, we have adult type amblyopia and strabismus and intermittent exotropia, which is an outer deviation of the eye. However, nowadays, we don't have any esotropia or inward deviation questionnaire that can measure the quality of life of the children and also the parents. So the rationale of this study is children with strabismus suffer from social, emotional, functional, and physical problems. And this lead to visual impairment, low academic performance, and affect their quality of life. An extremely limited strabismus-specific questionnaire at present to measure the quality of life of this specific condition. So a well-conducted study is strongly needed to develop a questionnaire, a scale, a measure to measure the quality of life of infantile esotropia from the perception of the parents and also the children itself. These are the conceptual framework of the study. So the general objective of the study is we want to develop and validate the new strabismus questionnaire and to evaluate the quality of life in the children and also their parents. Specific objective, we want to develop a new strabismic quality of life questionnaire for children and parents. We want to validate and also to measure the reliability of the newly developed questionnaires. And for the evaluation part, we want to compare the quality of life with normal children and normal parents. We want also, we want to know what are the factors affecting the quality of life in the children and parents. And lastly, we want to compare for the surgical management Is there any improvement before and after the surgery? So we come to the methodology. There are 3 stages of this study. First is development, second is validation, and third is evaluation of the quality of life. First stage is a developmental design, second is validation study, and third comprise of 2 parts, case control and prospective study. We managed to do this study from 2016 until 2019, approximately 3 years. And the study population is the children with IE, age 5 to 17, and their parents. Whereas at the last stage, we also recruit the normal children and their parents. The study location, first stage we done at Ophthalmology Clinic, Hospital University Science Malaysia. Second stage, this is more complex stage where involve 3 location, HRPZ2, HKL, and also SUKM. And the evaluation part, this is the part where we go out to do in the school, Tadika, Kalam Khalifah, Sekolah Kebangsaan Mulong 2, and also Sekolah Menengah Cabang 4, Tumpai. This is the flow chart of the study. To develop a questionnaire, it comes to a really complex process. First, we generate items from the literature review, survey, in-depth interviews, brainstorm with experts. In-depth interviews, we do qualitative study also. Then we select items and develop the first draft questionnaire. We go to the content validity with the linguistic expert and the second content validity with the experts in ophthalmology, optometrists, orthoptists, and also pediatrician. And also the child psychiatrist. And later we do the face validity, whether the patient can really understand what we are trying to measure on their perception. Then we do test-retest reliability. And finally, we develop the final draft questionnaire. And also we do another concurrent validity study. For the last stage of the study, we compare within the IE group and also normal group. And later, we compare before surgery and 3 months after surgery, where the children were examined and also they have to fill in the questionnaire. Study criteria for the children. We include all 5 to 17 years old infantile esotropia children. For normal, also 5 to 17 with good visual acuity, and we exclude organic eye diseases, neurological disorder, and all criteria that are listed. About the parents, we include all children diagnosed with IE age 5 to 17 years old and comparable to the normal parents, and we exclude any intellectual disability and psychological illness. So for the results, for the first stage, there are 2 results from this stage whereby we conduct survey and also qualitative in-depth interview. From the survey, majority children complain of visual function. When we say visual function problem, it comprises problems such as turning back, field of view, reading, whiteboard writings, and etc. And also, parents had anxiety problems such as they are worried about the future, job opportunity, surgery, what happens in the surgery, and so on. From the interview, this one is more depth, where we conduct qualitative in-depth interview. Majority children had visual function problems, social interaction, physical, and also emotional. And for the parents, they had emotional problems where they are worried, sometimes they feel bored, and they had problems with what happened with their children. For the stage 2, this is the validation study. We do the content validity with the experts. So the findings are all scale level content validity index are more than 0.8. For the face validity result, also we have all the SFI UA is more than 0.8. And for the construct validity, where this is the last part to develop a final questionnaire. This one, we recruit another pool of patients. And we found that from the construct validity, we gather social problem, emotional problem, and functional problem for the 5 to 8 years old version, and for 9 to 17 years old, psychosocial and functional problems. The Cronbach alpha is more than 0.8 for all domain. For the parents validity, construct validity, the Cronbach alpha and the factor loadings also meet satisfactory. And there are 5 domains, which is parents' emotional problem, children's social problem, children's emotional problem, children's functional problem, and also their own emotional problem. So this is the result. This is the final after we do 2 years of data collection. This is the questionnaire to measure the quality of life of the children. We come out with the 5 to 8 years old version where the children have emotional and social problem. And this is the result of the 9 to 17 years old. They have functional and psychosocial problem. This is the end of the final questionnaire, 10 items only. And the final parent questionnaire comprised of 25 questions, which include the children's social problem, children's emotional problems, children's functional problems, and parents' emotional problems. The test-retest reliability is as stated. And this is the concurrent validity where we compare with another gold standard questionnaire that is intermittent exotropia questionnaire. Lastly, for the evaluation stage of the questionnaire, this one we recruit another pool of patients. So the comparison between the normal, so significantly the quality of life of children and parents of infantile esotropia reduce compared to normal children and parents. Then we investigate for the factors associated with the quality of life in the children. All parameters that we investigated is not significant, including the angle of deviation, strepsis, and also gender. And we compare before and after surgery using the newly developed questionnaire. The quality of life of the children significantly improved after the surgery. For the discussion, this is the first questionnaire developed to measure the quality of life in children with infantile esotropia and their parents. And also, this is the second strabismus-specific questionnaire to measure the quality of life in children after the intermittent exotropia questionnaire. So the item that we generate is comparable with the ANSQ and also adult strabismus questionnaire and IE questionnaire. And for the team, our questionnaire shows more sensitive tool compared to the other gold standard questionnaire. For the content validity and face validity, we show high content validity index and also face validity index as recommended by Lin and Pelit. For the construct validity, it shows adequate sampling, good correlation between items and factors, and 25% of item variance is explained by all extracted factors, and the items was sufficient to explain the model. For the concurrent validity, it shows strong correlation coefficient with other questionnaires. And reliability, it shows high Cronbach alpha value and acceptable intra-class correlation coefficient with the gold standard questionnaire. So in conclusion, the reliability, we have more evidence of validity and reliability because we do content, phase, construct, concurrent, internal consistency, and also test, retest reliability to make sure our questionnaire developed is a gold standard. For the last stage of the evaluation of quality of life, children with infantile esotropia had impaired quality of life compared to normal. This is consistent with Hart et al. And also Sim et al. And parents also have reduced quality of life compared to normal parents, consistent with Yamada et al. And we found no significant association between the quality of life and gender, angle of deviation, and strabismus. This is consistent with other study also. So we postulate this is because maybe majority of the children had a medium level of shyness, including shyness to answer questions. So they this may be affect the answer of the questionnaire. For the comparison of quality of life before and after surgery, our findings are consistent with other 4 studies, whereby higher quality of life after surgery in children with infantile esotropia is detected. We come to the conclusion of the research. So we managed to develop 2 strabismus-specific quality of life questionnaire for children with infantile esotropia with different version, 5 to 8 and 9 to 17 years old. We managed to develop a new questionnaire for parents, and all questionnaires are valid by all the validities had mentioned before. All questionnaires are reliable. The mean total score of quality of life was significantly lower in children with infantile esotropia compared to the normal. This is also happened in the parents. Gender, angle of deviation, and strabismus did not affect the quality of life. And the quality of life of the children is higher after the strabismus surgery. Our study limitation is we had difficulty in conducting interviews on very young age group, less than 8 years. So we improved this where we developed the new child 5 to year old version with simpler words and attractive pictures. Future research. We want to translate the questionnaire into English version so that it can go worldwide. And we want to do study to evaluate the quality of life in other types of strabismus as well. In clinical practice, we believe that this new questionnaire can be administered to evaluate the need of children for strabismus surgery. We know that the clinical features such as angle of deviation, strabismus, and also all the clinical measurement is really needful for the surgeon to do the surgery or other management, but this can help the surgeon also to decide which of the children is more prone and better to go for the surgery first. And clinician can understand better the problems experienced by the children and their proxy parent. And it can also be a tool for medical and optometry education, such as in PBL or OSCE. These are my references. These are my list of publications, my poster and oral presentations. I acknowledge my supervisors for this very beautiful journey. Thank you very much.
Thank you, Dr. Wahida. A very long journey, but with a very beautiful outcome at the end of this PhD journey. Usually we will see the patients with eye deviation. We just focus on the eye rather than looking at their psychosocial aspect. I think Dr. Wahida has successfully managed to capture this important aspect and introduce to the clinician about this important aspect. Do we have any questions so that the speakers will be able to answer? Okay, let me go through this. Okay. There was one question from Prof. Zilfalil asking Dr. Wahida, yeah? What was the rationale for selecting the 4 school and Tadika for phase 2 of the study? Would the study finding have differed if the 4 selected Tadika has different demographic characteristic? Silakan, Dr. Wahida.
Okay, thank you, Prof. Zilfalil, for the question. Yes, our questionnaire include children from 5 to 17 years old, and therefore we have to cater the need and the population should be equally distributed. So we go to Tadika, Sekolah Rendah, and also Sekolah Menengah. So that's why there are 4 schools included in the phase 2 of the study. And the second question is, would the study's finding have differed if the 4 selecting schools for selected school Tadika had different demographic characteristic? Yes, sure, Prof. I think if we go further, let's say we go to the Chinese or Indian, this can be had different characteristics. What we do, that's why we go to for the second stage, we collect data for the clinical part in the Hospital Raja Perempuan Zainab II and USM, and we also go to UKM and also Hospital Kuala Lumpur. So we want to see the pattern between the Kuala Lumpur children and also the Kelantan children. So I think if we can, after this, go further, let's say in Sabah Sarawak or any region, that will be more exciting.